Hello guys, welcome back to my YouTube channel Info Pro. This is me, your Info Pro. So today's topic is crush syndrome. So what is crush syndrome? So it is a syndrome. Yeah, of course, we all know that. So it is happening due to the crushing of the muscle. So it is happening due to the crushing of the muscle and thus causing the extravasation of the blood and release of the myohemoglobin. So it is happening due to the crushing of the muscle and thus causing the extravasation of the blood and a release of myohemoglobin into the circulation. And all this into the circulation, and this leads to the acute tubular necrosis. So all this lead to the acute tubular necrosis as well as acute renal failure. So this leads to the acute tubular necrosis and acute renal failure. This is the introduction. Now for the causes. So let's know the causes. What all are the causes? The causes include earthquakes. So earthquakes. And second one is the mining. And the third one is the air crash. And the fourth one is the tourniquet. So all these are the causes that can lead to the crush syndrome. Now for the pathogenesis. Let's know what is pathogenesis. So initially the tension will be increased. Tension increases in the muscle compartment. So initially a tension will increase in the muscle compartment, and thus which itself impedes the circulation, and this tension which itself impedes the circulation and increases the ischemic damage, and that's for the pathogenesis. Now for the clinical features, what all clinical feature can be seen here? So in 3 days the urine become discolored after the discoloration. So the urine become discolored, and after the discoloration the patient become restless. So the patient become restless, apathy, and delirious with the onset of uremia. So what all are the urine discoloration, restless, apathy, and uremia? Now for the complication, what all are the complication? The complication includes the renal failure. So first one is the renal failure and toxemia. The second one is the toxemia. Third one is the septicemia. And the fourth one is the gas gangrene. And the fifth one is the disability. So all these are the complications. What all are? Renal failure, toxemia, septicemia, gas gangrene, and disability. Now for the treatment. So what is the treatment for this crush syndrome? So fasciotomy. Yeah, we all know that when the pressure increases or tension increases, fasciotomy is the best option that we have. So what is fasciotomy? It is the multiple parallel deep incision in the limb. So it is the multiple parallel deep incision, that is fasciotomy. And next is the mannitol. So to improve the renal function we are giving the mannitol. So to improve the renal function we are giving the mannitol, and it also improves the urine output. Thus the renal function is improved. And next one is the sodium citrate or sodium bicarbonate. So this drug will alkalize the urine. That's the use of the sodium citrate and sodium bicarbonate. So next one is the hemodialysis. So it is done sometime as a life-saving procedure, hemodialysis. And the next one is the other measures, which include the catheterization oxygen therapy, and antibiotics, antibiotics, and blood transfusion, blood transfusion. And the last but not the least is the correction of severe hyperkalemia. So, correction of the severe hyperkalemia is the last of the treatment, that is for the crush syndrome. So, that's why we are ending up our section for this crush syndrome. Hope you like my video, and thanks for watching. So you can take a screenshot from here, and thank you.